Now, let's face it and be frank with ourselves. Most of us don't like taking pills, including me as a pharmacist. So the hypothetical scenario, if I were to leave my doctor's office today, right now, with a diagnosis of high blood pressure and a recommendation to start taking the medication, chances are that I will discuss with my doctor to explore other options and only commit to taking the medication if those options fail. So in this video, I want to share with you 5 actions that I will personally implement before committing to taking medication in this hypothetical scenario. Now, it's important, however, for me to emphasize that everyone's situation is different and unique. And if your blood pressure is dangerously high, it may be necessary to start taking the medication right away to prevent any serious complications. So it's always best to discuss what your plans are with your doctor before taking any decisions. The first thing I'll do is to make dietary adjustments. First, we'll be eliminating potential problem foods, high sodium foods, frozen pizza, deli meat, canned soups, and the likes. Now, if you do a quick Google search, you can come up with a list of potential troublemakers or potential foods that can make high blood pressure worse. The focus will then be to shift to eating more potassium-rich foods. Now, potassium is a mineral that helps balance the amount of sodium in your body and relaxes your blood vessels. Eating more potassium-rich foods can help lower your blood pressure and reduce the risk of stroke and heart disease. Some of the best sources of potassium are fruits and vegetables, such as bananas, oranges, potatoes, spinach, and avocado. Other good sources are beans, nuts, seeds, and fish. So find out what works best for you and incorporate it into your regular diet. Number 2, exercise regularly. Physical activity can help lower your blood pressure by strengthening your heart and improving blood circulation, as well as even reducing stress. Now, you typically want to aim for at least 150 minutes of moderate intensity exercise per week, which translates to about 30 minutes daily for 5 days or so in a week. Or if you're up for it, you can do 75 minutes of vigorous intensity exercise per week. Or even you can do a combination of both if you're up for it. Some examples of moderate intensity exercise are brisk walking, cycling, swimming, dancing, or even gardening. And some examples of vigorous intensity exercises are running or jumping rope. But the key here is that it doesn't have to be fancy or complicated. You don't need a gym membership per se. I mean, if you can afford a gym membership and commit to it and go every day or however times you decide to go, then that's great. But a 30-minute walk after dinner with your dog, using the stairs instead of the elevator sometimes, parking a little further from the entrance to the grocery store, all can add up and go a very long way to help. Number 3, manage stress levels. Now, during stress, your body releases hormones such as adrenaline and cortisol. These hormones temporarily increase your heart rate and cause your blood vessels to constrict, leading to a spike in blood pressure. Now, if you are constantly stressed, then this gradually develops into long-term hypertension. Another bad thing about stress is that it can actually lead to behaviors that contribute to higher blood pressure. For example, some people may cope with stress by overeating, consuming high sodium comfort foods, drinking alcohol, or even sometimes people take to smoking when they are stressed. Now, these behaviors can indirectly contribute to hypertension. To manage stress levels, it's always a good idea to identify the sources of stress in your life and find ways to cope with them. It may mean finding a new job if possible, or sometimes even cutting back on hours if you are in a financial position to do so. It may mean getting out of a toxic relationship, or it may just mean letting some stuff just go. Some people and some situations are just not worth it. You really don't have to fret about every little thing. And I hope I'm speaking to some parents with kids here. Sometimes the kids can send you in a different dimension, and it's so difficult if you don't control yourself. You can also engage in some effective stress management techniques such as breathing exercises, massage, or spending time with friends and family. In some cases, though, you may need to seek professional help to help you manage your stress. Number 4, lose weight. Carrying excess weight can increase your blood pressure by putting more pressure on your blood vessels and making your heart work even harder. Losing weight can lower your blood pressure and reduce the risk of other health problems such as diabetes and even high cholesterol. Now, here is a quote from some randomized control intervention studies. A decrease in body weight by 1 kilogram, which is about 2.2 pounds, resulted in a reduction of systolic and diastolic pressure by 1.2 and 1.0 millimeters of mercury, respectively. Blood pressure generally decreased before normal weight was achieved and remained reduced as long as there was no marked regain in body weight. Now, this is huge because losing about 15 to 20 pounds if you're overweight can translate into blood pressure reduction comparable to some medications that are prescribed for high blood pressure. To lose weight safely and effectively though, it is not a good idea to follow any fancy diet, which you know very well is unsustainable. Just follow a balanced diet that is low in calories, low in sugar and salt, but high in protein, fiber, vitamins and minerals. A good diet that I can recommend is the DASH diet. Take a look at it and see if that will fit your needs. Also, it's important to increase your physical activity and try to limit sedentary behavior such as sitting for long periods watching TV or just sitting for long periods just scrolling on your phone doing nothing. Number 5, quit smoking and limit alcohol. Now, I personally don't smoke or drink, but I believe this will help somebody. Smoking is one of the worst things you can do for your blood pressure and your overall health. Smoking damages your blood vessels and increases the buildup of plaque in your arteries. This can narrow your arteries and make your blood pressure rise. Smoking also reduces the amount of oxygen in your blood and makes your heart work even harder. Now, quitting smoking can lower your blood pressure and improve your cardiovascular health within weeks. Studies point and prove this. If you need help quitting smoking, talking to your doctor for some nicotine replacement products or some other medications can be very beneficial and can go a long way to help you quit than trying to go cold turkey. Now, alcohol. Alcohol can stimulate the sympathetic nervous system, which controls what we call the fight or flight response. This stimulation can increase your heart rate and cause the blood vessels to constrict, both of which contribute to elevated blood pressure. Unfortunately, alcohol can also affect the balance of the electrolytes in your body, including the famous potassium and sodium. This imbalance can impact blood pressure regulation. Now, as I mentioned earlier, some people may still need medications to help even after implementing these. Hence, they need to closely monitor and discuss whatever results that you're getting with your doctor. On your screen now is another video that I think will help you in your quest to lower your blood pressure. Stay blessed and catch you on the next video.